Hi everyone. Welcome to On Point. In this video we are going to discuss about leukocyte disorders and leukemia. So without any delay, let's start the video. Leukocyte disorders and leukemia. Leukocytes, white blood cells, are essential components of the immune system, protecting the body against infections and diseases. Disorders affecting leukocytes can lead to either an excessive or insufficient number of white blood cells, or to abnormalities in their function. 1. Leukocyte disorders. Leukocyte disorders can be broadly classified into two types. A. Quantitative disorders. These involve abnormal numbers of white blood cells. Leukocytosis, an increased white blood cell count, which may occur due to infections, inflammation, stress, or leukemia. Leukopenia, a decreased white blood cell count, making the body more vulnerable to infections. Causes include viral infections, autoimmune diseases, bone marrow disorders, and chemotherapy. B. Qualitative disorders. These affect the function of white blood cells. Neutrophil dysfunction syndromes, example chronic granulomatous disease, impair the ability to fight bacterial and fungal infections. Lymphocyte disorders, example severe combined immunodeficiency, lead to weak immune responses. Monocyte or macrophage disorders can result in chronic infections or immune dysregulation. 2. Leukemia. Leukemia is a type of blood cancer that originates in the bone marrow and results in the uncontrolled proliferation of abnormal white blood cells. These abnormal cells crowd out normal blood cells, impairing the body's ability to fight infections, carry oxygen, and clot blood. Types of leukemia. Leukemia is classified based on the speed of progression, acute or chronic, and the type of white blood cell affected, lymphoid or myeloid. 1. Acute leukemia, rapid progression. Acute lymphoblastic leukemia affects lymphoid cells and is common in children. Acute myeloid leukemia affects myeloid cells and is more common in adults. 2. Chronic leukemia, slow progression. Chronic lymphocytic leukemia affects lymphoid cells, often found in older adults. Chronic myeloid leukemia affects myeloid cells and is associated with the Philadelphia chromosome mutation. Symptoms of leukemia. Persistent infections. Fatigue and weakness. Easy bruising or bleeding. Swollen lymph nodes. Bone pain. Unexplained weight loss. Causes and risk factors. Genetic mutations, example Philadelphia chromosome in CML. Radiation exposure. Chemical exposure, example benzene. Certain genetic disorders, example Down syndrome. Smoking. Diagnosis and treatment. Leukemia is diagnosed through blood tests, bone marrow biopsy, and genetic studies. Treatment options include: chemotherapy, kills cancerous white blood cells. Radiation therapy, targets leukemia cells in specific areas. Targeted therapy, uses drugs to block specific molecules involved in cancer cell growth. Bone marrow transplant, replaces diseased bone marrow with healthy cells. Conclusion. Leukocyte disorders range from mild infections to life-threatening conditions like leukemia. Early diagnosis and appropriate treatment are crucial for managing these disorders effectively. Regular checkups, a healthy lifestyle, and awareness of symptoms can help in the timely detection and treatment of these conditions. That's all for now. For more updates, please do like, share and subscribe. See you in next video.